The Special Needs of Children with CHARGE Syndrome by Tammy Speidel. CHARGE syndrome is a rare genetic disorder. It is not passed on from parents, but is rather a mutation, meaning it occurs for the first time in the individual child. It is centered in gene CHD7, which is a crucial gene in the development of several important organ systems, including those of the heart, inner ear, and retina. CHARGE is characterized by multiple physical, sensory, and behavioral anomalies affecting hearing, vision, oral sensory systems, swallowing, breathing, and heart conditions. These occur in a wide range of combinations and levels from mild to severity in each child. CHARGE derives its name from an acronym for the 6 major impairments present in most CHARGE cases. These are coloboma of the retina, impairing vision; heart abnormalities, often requiring surgery; atrasia cornea, malformation of bone and cartilage of nose and breathing impairments; retardation of growth and/or development; gastrointestinal, genital, and urinary malformations; and the inner ear system malformations, impairing hearing. In addition to these, or more accurately, as a result of these malformations, swallowing, breathing, and digestion are affected. The esophageal and breathing passages may have holes or be interconnected. The inability to swallow, thus not being able to receive nourishment, is one of the most prevalent and earliest signs of CHARGE. Soon after birth, one or more of these anomalies will be evident, requiring medical assistance. A child may have some of these impairments or all to differing degrees, requiring care and intervention specific to the child's needs. Surgeries to correct the physical malformalities are common, and many will undergo several before their 3rd birthday. Addressing their inability to swallow is often remedied with feeding tubes, either through the nose or as a feeding tube surgically installed in their tummy. Heart conditions may be mild, not requiring surgery, or severe, requiring open heart surgery within the first few months of life. For babies with CHARGE, the primary concern for parents is simply keeping them alive. Once an infant makes it through their first year of life, their physical growth matures and poses less risk of danger. Other physical impairments that may require surgery are hearing and nasal passages, and a big part of that first year of life is therapies, medical intervention, and a whole host of teams working with the parents on behalf of their child. Early intervention is crucial for an infant with CHARGE as well as for the family. IDEA provides early intervention through state and local agencies. In Florida, Early Steps assists the child and family with a team of specialists and therapists in the areas of medical services, educational therapies and specialists, and community services, including parent support groups and resource services. These work with the families in the home, making the parents the infant's first early educator. Parents are expected to participate in therapies throughout the day to assist the child in developing. When the child turns 3, IDEA continues to provide intervention and support through the Child Find program. At this time, preschool programs able to accommodate the physical and cognitive needs of a child with CHARGE may be brought in for the child's continued growth. In Hillsborough County, there are preschools that focus on deaf-blind impairment that would be perfect for a child with CHARGE. Often, parents opt to keep their preschoolers at home and to continue to educate them with therapies and educational assistance in the home rather than in a center, as their health can be still fragile at this time. These are the 3 sections of teams that work with the child and family for the child that has CHARGE. The medical team, the educational team, and the community services team. They all work communicating with one another and with the family to provide the best care and services for the child. These teams are provided through the federal government program of IDEA. medical team, the educational team, therapies, educators, all helping the child with charge, and the community team. Therapies and education for a child with Charge syndrome. There are 3 areas that I want to focus on now for educating a child with Charge. The deaf-blind approach to learning, the sensory processing disorder approach to learning, and the value of a learning coach or intervener within the classroom for the child with Charge. The approach to learning is different with children with deaf-blindness. Much sensory data is not available to those children, and caregivers need to draw the child into these sensory explorations and connections. Establishing a relationship as the basis for learning is very important with the deaf-blind child, such as a child with Charge. Creating a trusting relationship, we need to take the extra time to be in close proximity, to be the hands and the arms of the child. We bring materials to the child. We have them place their hands on ours as we explore the object, and then we place our hand on theirs as we guide them to explore the object on their own. Language-rich encounters with the child will also include describing with meaningful language the experience they are having and its elements. We cannot know how much of our effort will be understood or clearly audible with their particular level of impairment, but these types of interactions are vital to creating connections with the child. We need to look for ways to build on joint attention. If we observe the child moving their body rhythmically, we need to join them and imitate the type of body rhythm back to them. They may not be able to see or hear us or see us clearly. We need to do this through our body motions on their body motions. For instance, if a toddler is shaking an object with a rhythm of 1, 2, 3, you can gently pat their arm or back and say 1, 2, 3. If the child's body or facial language displays a positive response to you joining them, then continue. As teachers, we are focused on what to introduce to the child, but it is more important for us as caregivers to focus on what the child is introducing into the moment and then respond to them through imitation and variation. These types of physical exchanges are as deeply significant in language development as verbal exchanges are. And for deaf-blind learners, communication goes beyond the simplistic use of voices as we in the hearing-seeing world are accustomed to. Consider this for a moment. Take verbal exchanges out of communication, and how will the whole realm of language and social development be affected? How will we, as caregivers and facilitators of learning, convey meaningful language exchanges with a child with Charge who has hearing and vision impairments? Proximity is the key. Touch and closeness and paying attention to the child and what they are conveying to us. Sensory processing and sensory integration are major considerations with children with Charge. There are 3 fundamental senses from which all other senses build on. The tactile sense, which is touch, the vestibular sense, which is balance, and the proprioceptor sense, which is pressure. In children with Charge, the ability to organize these 3 senses is impaired in varying degrees, making the development of the other senses even more complicated for sensory processing. Add to this the impairment in vision and hearing. The entire process of organizing sensory information for learning in children with Charge is complex. These 2 additional senses, which complete our 7 senses, the vestibular and proprioceptor, are not usually talked about in child development or early learning experiences. We may not have even heard the words vestibular or proprioceptive before, but we use these senses nonstop without even thinking about them. While we may not ever encounter a child with charge in our classroom, or even a child with any type of hearing vision impairment, chances are very high that we will encounter a child with sensory processing disorders, either diagnosed or overlooked, so understanding the sensory processing system in child development is extremely important. Proprioception deals with the child's body awareness, their muscle tone, and their ability to move their body, to know where their body is, and to know what kind of force with which they need to exert their muscles for their desired outcome. The vestibular processing, it deals with balance and spatial awareness, especially in the head area. The primary function of the vestibula is for the child to know where their head is, its position, if it's moving, and what direction it is moving. The vestibula is located inside the inner ear, and so malformations in that are what makes the processing and the organization of information for a child with charge difficult. Sensory integration therapy helps children with charge develop compensatory behaviors that help make up for what they lose through their malformed sensory processing system. One way to accommodate a child with charge and address their sensory processing deficiency is to provide them with a sensory-rich diet. Lots of tactile experiences that are exaggerated in duration and participation. For instance, the child in the ball pit is an example of this. Whereas in a classroom, we might have each child take a 1-minute turn in the pool filled with balls. For the child with charge, we may give him 10 minutes to take in all of the rich stimulation and sensory information. One of the behaviors we might see in the early learning environment is a child who self-stimulates. This is a healthy activity for sensory development and should be encouraged. This is demonstrated by the young boy here who is throwing the packing peanuts up in the air over and over, being delighted with the sensation and sensory input that this experience is providing for him. Another type of beneficial sensory experience is maneuvering in tight spaces. The compression on their physical bodies is stimulating their brain activity and information processing. For instance, being in bean bags or in small cubbies is very beneficial for the sensory integration for children with charge. Going along with this, children with charge need additional support for their body due to its weaker muscular development and body space awareness. So providing pillow or beanbag chairs for the child to situate themselves on during activities is important, and it also provides additional sensory stimulation. Because of the head position and balance issues, providing the child opportunities to lie on the floor to explore objects is one way we can also support their learning. The third approach to learning for a child with charge would be a learning coach or intervener. This is an educator or caregiver that works one-on-one with the child. This is different than a therapist who has specific tasks that they are working with the child to accomplish. But a learning coach or intervener actually becomes the child's primary playmate, bringing items to the child, helping the child learn the characteristics of the objects, giving them sensory-rich experiences. In the early learning classroom, the teacher and caregiver provides this for the whole class. With a child with charge, because they have such a small communication bubble, they need their experiences up close and personal. Having a one-on-one caregiver also in the room, in addition to the educator or caregiver, is crucial for children with charge. Here is a YouTube link to Kevin Jake, who has charge syndrome. Notice how he uses the couch to take in sensory information, how he uses it to support his vestibular and proprioceptive sensory systems, how he tries to bury himself deep into the couch cushions, and also notice his hand is signing words. He's 17 months old. Click on the link and it'll take you to YouTube. Key points for early education professionals. What sensory systems are impacted in children with Charge syndrome? How do early steps in Child Find offer support for the early childhood educator who has a child with Charge in the classroom? List 3 strategies an early childhood educator can use to assist learning for a child with Charge.